New reports from the American Cancer Society is showing cervical cancer cases are declining in some women, but for some women, especially in their 30s and 40s, cases are increasing.
Yeah, this morning our 9 News health expert, Dr. Payal Kohli, joins us to explain a little bit more. Good morning, Dr. Kohli.
Good morning.
Thanks for coming in.
First of all, can you explain what cervical cancer is?
Yeah, so the cervix is the opening of the uterus. And cervical cancer is one of those cancers scientifically that we really understand very, very well. Most cervical cancers are caused by an infection or a virus. And that's what makes it different from other types of cancers. And this is human papillomavirus, or HPV, which occurs everywhere. It's ubiquitous. And pretty much everyone who's sexually active is going to get infected with HPV. Now, half of the HPV viruses that are out there are these high-risk types that can cause cancer. And our immune system tries to fight it off and keep the virus at bay, but if it sits inside those cells, it can cause some of these cancerous changes.
Why are you seeing an increase in some women and a decline in others?
Yeah, so it's fascinating because in 2006, they approved the HPV vaccine, which can protect you before you're sexually active from ever acquiring these high-risk HPV viruses. But there was a generation that was sort of too old for it, because once you've already become sexually active, you can't get the vaccine. And these are the women that are now in their 30s and 40s. And then layer on top of that, that the awareness of sort of screening, getting our pap smears on time and getting them regularly, especially in our 20s, has gone down. The possibility of more sexual partners, as well as some other sort of markers of risk that have accumulated, like birth control use, is associated with cervical cancer. Having a number of children is associated with cervical cancer. Smoking or vaping is associated with cervical cancer. So putting all that together, we're starting to see an increase when really we had been making so much progress with such a big decline for so many decades.
I remember a few years back, this really made the headlines when Erin Andrews, who's a popular sportscaster, she was diagnosed with cervical cancer, and she was a younger woman. So a lot of people started asking, who exactly is at risk? Or are they at risk? You know, at what age are you?
So sexual partners confers risk, right? Because the more sexual partners you have, the more at risk you are. If you're not been vaccinated, you're at risk. But women who are overweight, women who smoke, women, like I said, who may even have been exposed to something in their mother's womb, when they were still in the womb, called DES, are at higher risk for cervical cancer. And one of the challenges about this particular cancer is you don't really have symptoms. You know, so because the cervix is sort of a hidden organ, we don't really see it a lot. And the way we're going to know that it's becoming cancerous is by looking at those pap smears. Until it's very, very advanced, you're not going to have any kind of abdominal pain or discomfort or bleeding or anything like that.
So you bring up a really good point. Obviously, early detection and, getting your pap smear is super important. How often should women be getting those?
So in your 20s, you should be getting them every 3 years. And if you've ever been infected with the high-risk HPV virus or have had an abnormal pap, your gynecologist may recommend something different. In your 30s to kind of 60s, you can space them out every 5 years with respect to your pap smears, but you really need to start early and stay on top of it, because if you don't, you certainly, like I said, can miss the cancer, and it's a slow-growing cancer, but if you catch it early, it's highly curable. We can just sort of take out that piece of the cervix and hopefully, you don't have to deal with it after that.
Other than that, are there other ways to prevent it?
It's preventable and curable. That's what about this cancer is nobody should be dying from cervical cancer, because if you get that vaccine, and we're talking girls and boys now getting the vaccine, when they're 11 or 12 years old, before they become sexually active, they can get it as early as 9 years and as late as 26 years. It's basically going to prevent you from getting that HPV. And the reason we have boys get vaccinated as well, even though they don't have a cervix, is because these HPV subtypes, these bad viruses, can be involved in 6 cancers, not just cervical. So you can get penile cancer, throat cancer, mouth cancer, anus cancer, all these different cancers that men or boys can get as well.
Same thing for boys, though, too? You can't get it once you start being sexually active?
You can probably still get it. Talk to your doctor, but it's just not as effective once you start becoming sexually active. But it's never too late to actually have that conversation, especially if you have a lot of partners or risk factors, or you're worried about it, as we talked about, because your immune system, let's say you have HIV or something else, is different. Right? And people who don't have a normal immune system can be at higher risk for reactivation or waking up of the virus and causing trouble. So just because it's so preventable and treatable, I think this conversation is so important.
Dr. Kohli, thank you so much for coming in. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. There's a bunch on there that you can check out. As always, thanks so much for coming in.